Now let's go through a pediatric BVM skill. First, the equipment that we need is very similar to the adult station. You want a variety of sizes of OPAs. You want a towel to pad in position. You may want to have a tongue depressor, appropriately sized mask, and BVM. A couple things I'd like to point out with a pediatric BVM that may be different from your adult is you want to make sure that you have a pop-off valve, one that you can override if you have high airway pressures, but for the most part that pop-off valve should be in place. And then also a pressure monitor or manometer to let you know that you're not overinflating the lungs or giving high pressures. And then lastly, you can also use PEEP for children, but just start very low and elevate the PEEP as needed to improve oxygenation. So we're going to start by coming up to our pediatric patient. We're going to size and insert a proper size adjunct. Sometimes you may need to use a tongue depressor to help you insert the adjunct, being careful with the soft palate as you rotate into position. Now I'm going to take the mask and just like an adult, I'm going to rock it, I'm going to roll it onto the face, I'm going to do 2 thumbs up and pull the jaw into the mask. My partner's going to help me now by bagging the patient, and we're going to look for good chest rise. So hopefully I have good chest rise here, but often with children I need to reposition them to get the ear to sternal notch alignment. So if I'm not getting good chest rise with a pediatric patient, I may take my towel and pat under the shoulders or the head, depending on the size of the child, to make sure I have good ear to sternal notch. Much like an adult, I can further troubleshoot by rotating the child's head slightly to one side or the other. This helps overcome redundant tissues and helps with BVM technique. Last, once I know I have good chest rise, I can put on my end tidal for further monitoring. 35 to 45 is the range for children as well as adults. And then don't forget to get your SpO2 probe on the patient and make sure that your SATs are between 92 and 98%. If your SATs are low, remember you can gradually increase the PEEP until your SATs rise.